Good morning, PT on Ice Daily Show. Good morning, happy Thursday. I am your host here on Leadership Thursdays. My name is Alan. I'm the pleasure of serving as COO of Ice as well as teaching in our fitness athlete division. Wearing my Rogue Christmas hoodie because it's Michigan and it's January, so it's absolutely miserable this week with snow, rain, ice, sleet, all sorts of weather within 1 week. Classic pure Michigan weather. Happy to have you here today. Want to say thanks to the TPI crew out in Minneapolis last weekend before last, January 12th and 13th. Haven't been on here since then to say thanks. Huge turnout, 45 people throwing down on some barbells, learning some fundamental movements and ways to help both athletes and integrate those movements into the traditional clinic. So great course out there with TPI in Minneapolis. Thanks again to everyone who showed up. Before we get started, I want to announce that tomorrow I've been roped into, I don't know what the appropriate term is, to try and do 29,000 feet of stepping to climb Mount Everest for the APHPT for their Climb DC Challenge out at CSM in DC this weekend for those of you out at CSM. So if you're going to be at CSM, find the APHPT folks around. They will be doing things like stepping on Rogue boxes on the convention center steps and all that sort of stuff. There is a step challenge. If we can get enough elevation climbed as a group, the Academy will reduce the price on memberships maybe. We'll see. But for my part, I will be stepping on my steps here in the house, or maybe out in the garage on a plyo box to try and do all 29,000 feet on my own. I think I've done it this time. I think I've bit off more than I can chew. I've always pulled through on these stupid things in the past, but this one might get me. But I'll do my darndest and try and get all 29,000 feet in. Busy month here at ICE. Lots of courses in February. We have our certification course, speaking of APHPT, our CERT APHPT course starting February 4th. We have Dustin and Christina going out to Wind City Physical Therapy in Casper, Wyoming, February 9th for Modern Management of the Older Adult Live. We've got Justin teaching Persistent Pain Management February 18th. That's 8 weeks online. And we've got Justin again the next week, February 23rd, teaching Total Spine Thrust with Zach Long down in Charlotte at his clinic at Carolina Sports Clinic. That same weekend, busy that weekend, we've got Jeff teaching cervical spine management at Delta PT in Baton Rouge, and we've got Jessica Davis teaching her performing artist course in Fort Worth, Texas. So very, very busy month. So announcements over with. Let's get into the meat and potatoes here. What are we talking about today? I wanted to kind of build on what Jeff's been talking about the past couple weeks. So if you haven't caught those episodes, go back and review those. Those are the last 2 Thursdays. They go in order. So the first one is You Eat What You Kill Only Always, and then Side Hustles, Yay or Nay. So grab those 2 episodes. That'll kind of give you the foundation of what I'm going to be talking about this morning. So Jeff, to kind of summarize it a little bit, Jeff talked about in the first episode of how to kind of make sure that you're present in the moment with your organization, in your clinic group, if you expect to do any progress, right? If it's evident that you're just there to get a paycheck, you can't expect to receive any sort of maybe raise if we're talking about money, or more responsibility, more of a managerial role, more of a promotion, whatever it might be. If it's clear that you're not invested, if you're not in it to win it, then you won't go very far in an organization if it's clear that you're not invested in it. And then last week he talked specifically about side hustles, about consider discussing with your current organization, your current clinic group, your current company, whoever you're working for, if you have that notion that you want to do something specialized, you want to branch off, don't just try and go out on your own, right? Consider with the organization you're in that they might be interested in partnering with you with that, right? That could be maybe part of your job, or maybe become all of your job, right? And still stay with that organization. So trying to remain within that organization instead of just saying, you know what, I want to do my own thing. I'm going to open my own clinic. I'm going to open my own side hustle, and kind of just checking out, just collecting that paycheck and kind of dipping out of there. So flipping that scope, I want to talk about from the employer, manager, director, owner, leadership angle. I apologize. I had to pause. I was coughing uncontrollably. So from that employer, manager, director, owner, leadership angle, how can we reduce turnover, right? How can we keep those folks, keep them invested in the organization? How can we invest in them, right? That's the whole point I want to get across today, is how can we invest in our people? So that's where the name for this episode comes from. Take care of your people and your people will take care of you, right? It's an old saying from the Army, right? Take care of the people underneath you, and it's not surprising that your team, your organization, your group will do well, right? We used to say the same thing about our equipment, right? Take care of your equipment and your equipment will take care of you. Perform regular maintenance on things like your rifle and your truck and every part of what you do, and it's no surprise that it won't let you down when you need it, right? So the same goes with people. We should treat people the same way. We should invest in them heavily and then not be surprised that that investment gets returned, more than a 1-to-1 ratio, which is exactly what we want. So we know that turnover in PT can be very high. A great study by Camp et al. In 2009 looked at job strain in PT and found that PT has a turnover rating between as high as 16%, depending on your setting, after initial survey and then 1-year follow-up. And that looked at 857 PTs. Some of the major issues listed for that 16% turnover was burnout among younger therapists, lack of job control, and variety in practice, right? So those are all kind of the common things that we're used to hearing. Another study in 2008, a workforce study, looked specifically at PTs working in skilled nursing facilities and found a turnover rate as high as 85%, which is, whoa, that's a lot. Another study, 2004, by Waldman et al., found that turnover in healthcare can cost as much as 5% of total revenue to the organization. So, wow, holy cats, that's a lot. If you're making $1 million gross a year, that's 50 grand. Now multiply that by however many people you've turned over that year, and that money starts to snowball, right? I know a speech and language pathologist, not exactly PT, but similar field, who pretty much on the anniversary of wherever he's been at his job, he has already looked for a new job. If he's found something better, he has applied, and then he will then take that to his current employer and say, hey, match this or I'm gone. And he's been doing that for over a decade, right? And I mean, for him anyways, surprisingly good results of either the current employer matching it or jumping ship, right? And that's what we don't want to see with our people, right? That costs a lot to all the organizations that he's left. And you can't really blame somebody with the way student loans are and all that sort of kind of the normal stuff that we hear. You really can't blame folks for looking out for themselves, right? That loan payment is due every month, no matter what. So if it is a money thing, then you can't expect people to not be looking elsewhere. But know that there are folks out there with that mindset that they are always looking for something better, and if you can't provide it, they're going to go where it can, right? So understand turnover and how much it can impact your organization. We want to do everything we can to reduce that turnover, keep those people internally. It's better for everyone involved to keep them there for as long as possible. So I want to talk about 3 key points today. I want to talk about recognizing that therapists are worth more to your organization than just the number of patients they can see, just the number of units they can bill. I want to talk about the notion that people will tend to trend towards specialization, and we should encourage that. We should embrace that. We should facilitate that. We should know that depth is better than width, and we should know the third point I want to make is that we should always choose happiness over money, especially when it comes to our organization, when it comes to taking care of our people. So let's dive into that first point. So recognize that people are worth more than the number of patients they can see and the number of units they can bill. We try to push efficiency and productivity on everybody that walks in the door, regardless of where they're at in their practice, how far they've been out. We say, hey, this is your productivity. Deal with it. Get good, right? Sucks to suck. Get better. And especially for newer PTs, too much too fast will burn them right out. That's what we hear the most from newer grads, newer PTs, is they just get to a clinic and it's, hey, you're seeing somebody every half an hour, you're seeing somebody every 15 minutes with the assistance of a PTA, and we're crushing these folks, right? And it's no surprise that they don't last long, right? So we need to understand that folks need some time. Some folks need more time than others. Some folks may never get to the point where they're comfortable with a higher volume schedule. but that most folks will naturally become more efficient in their practice as they mature in their practice. That clinical pattern recognition gets better, and they may be able to handle a higher patient volume or more responsibilities in addition to seeing patients. They may be able to take on some managerial roles, but understand that that takes time. So as the leader of the organization, the clinic director, manager, owner, whatever you are, what does your productivity look like for new PTs? Do you even have a policy? It should probably be 1-to-1 for an hour, especially for those new grad PTs. And it shouldn't be an arbitrary timeline of when that changes. It shouldn't be 1-to-1 for an hour and then in 3 months it ramps up, right? That's arbitrary. It doesn't take into account differences in folks. You should have a discussion with folks. You should involve them and say, hey, are you more comfortable? Are you comfortable now jumping from 1-to-1 for an hour, maybe with some heavy admin time built in the day for documentation? Are you comfortable dropping down some of that admin time? And by admin time, I mean paid time, right? Not lunchtime, not 10 p.m. at night after the kids are asleep, logging into WebPT to do your documentation. I mean built-in admin time to stay caught up on that stuff. So, hey, are you ready to drop some of that admin time and fill that time with patients? If yes, move forward. Hey, are you ready to drop from 1-on-1 for an hour to maybe a patient every 45 minutes with the assistance of maybe a tech or a PTA or a more seasoned PT that's available? If yes, then proceed forward. And it should go like that, and it should be a discussion, and it should be involved, and it should be an investment, but kind of hitting on that theme again and again. So setting that firm standard, hey, you need to see this many people, build this many units, or get out. That's not surprising that doesn't go over very well, right? And recognize that nobody really wants to see 20 patients a day. Not really, right? Some people will say, hey, I'm totally comfortable. I love seeing a bunch of patients. Like, I love being in the grind. But most people don't, right? As PTs, we're kind of these touchy-feely human beings. We like to see people get better. We like to solve problems, and that doesn't really happen, especially at those higher volumes. As that volume gets higher and higher and higher, it's no surprise that we see those outcomes jump down. So recognize that some folks will just never be comfortable with that. And if you think that they are good therapists, if they have those good outcomes and they have those referrals that keep coming back and back again because people like that approach, then recognize that while that may be a short-term profit loss for you, over time, it's going to be a long-term profit gain, right? We're playing chess, not checkers here. And recognize that some specialties will just can never work with that, right? You can't double book pelvic floor, right? That's not how it works, especially if you're doing internal pelvic floor stuff, right? Some of that stuff will just never happen. Some of those specialties, if you're looking at video gait analysis with running or working with weightlifting mechanics with athletes, some of those specialties will never trend towards seeing multiple patients at the same time or at a very high volume. So just recognize that and understand it. So my second point is to recognize that people tend to specialize as they mature in their practice, right? People will, over time, trend towards some sort of subpopulation. It just seems to happen. Some folks always kind of stay in the general outpatient orthopedic mindset, or maybe kind of general neuro, where they are okay at treating a couple different things. But most folks, sometimes even before they become a physical therapist, know what kind of group they want to work with. Hey, I want to work with dancers after school. I already know. I want to work with CrossFit athletes after school. I already know. I want to work with patients with Parkinson's after school, after I'm done with school. They already know their specialty. So embrace that, encourage it, right? I mean, we see that here at ICE, right? We have faculty that are specialized across a number of different areas. So Jeff's main role is being the ultimate hype man, right? Just kidding. So Jeff is, specialized in spinal treatment, persistent pain treatment, and now getting really into industrial health. Kristen is specialized in lymphedema treatment, kind of integrating CrossFit-esque style treatment and exercise with moms and postpartum women in her community. Eric is our extremity expert, right? Especially the shoulder and knee. Zach and Mitch are the fitness athlete guys, right? Working with high-level athletes, CrossFitters, weightlifters, etc. Jason is the running and the cycling guy and the bike fit guy. And on and on and on, right? Justin's the persistent pain guy, the spinal guy. Morgan's the primary care lady. Mike and Allie are the population health folks. Jessica is the lady that likes to work with dancers. Dustin and Christina are older adult experts. RJ with vestibular. Sarah with hip and FAI and CrossFit and dance and kind of everything going out there with Auto Network out there at Aero PT in Seattle. And then Steve is kind of our elite sports and strength and conditioning guy. So even in ice, we don't have a bunch of generalists, right? We have specialists who together as a group cover a very broad area, right? And I'd always much rather have a team of specialists who can cover a very broad area or together all areas than a team of generalists who kind of do okay at a broad area, right? We want depth here, not width. If we can get somebody who's deep in all of these different areas together, we can cover a lot. And your clinic should kind of look like that, right? You should have somebody who's really good at working with patients with persistent pain, somebody who likes to work with athletes, somebody who likes to work with maybe dancers or older adults or that lymphedema specialist, right? If you look at bigger clinic groups, clinics that maybe have 5, 8, 10 PTs at that clinic, you'll see that each one kind of has a specialty, and together they cover a very broad area. So recognize that folks will tend to specialize and trend towards certain populations, and embrace that, encourage it, right? Encourage that specialization, and encourage them to pursue that interest. And maybe that means they don't spend as much time in the traditional clinic setting, kind of back to point one, just seeing patients and billing units. Maybe that means you have a PT that leaves in the afternoons to go to the CrossFit box or the dance studio or the job site, the local high school to work with the strength and conditioning coaches or the college sports teams, running groups, on and on and on, right? So that might look different than just being in the patient kind of grinding it out day after day, but you can still make money that way, right? It might not be the traditional turn units into money with insurance that we're kind of used to, but nonetheless, you can still make money that way. And most importantly, you're showing an investment in that employee and that therapist, which is just going to increase their loyalty to your organization that much more. And back to kind of the whole point of this, reduce that turnover, reduce the likelihood that they leave, right? We know that it's very, very costly. The final point I want to make, wrapping up here, I know I'm a little bit long here, is choose happiness, not money, right? I was listening to the AMRAP Mentality podcast with Jason Khalipa. It's kind of a CrossFit business podcast, and he had Gary Vaynerchuk on. So Gary V, a lot of you know Gary V. And Jason asked Gary, like, what is the secret to your success? And he said, I like happiness more than money. And when he unpacked it a little bit, he said, our gross revenue is very, very high, but our net profit is very, very low. We could make infinitely more money if we cared less about the happiness of our people and more about increasing that net profit. And he said simply, I like happiness more than I like money. And so if you are failing at point one with not treating therapists more than just the number of units they can bill, and you're failing at point two, which is not encouraging that specialization, getting outside the traditional clinic, or both, then not only are you starting to risk incurring the cost of turnover, but you're starting to create competition within your clinic if somebody leaves where it didn't exist before, right? We want to keep people happy. That might mean we make less money. That might mean even less money than potentially we could, but it's worth it to keep people happy and keep them in the organization because we know those costs of turnover are so high. So, sorry, I had to pause again. Another huge sneeze cough attack. So if we can keep people happy and stay there, we know that turnover reduces over time. And I would just say, if you have that therapist that wants to get outside the traditional clinic and specialize somewhere and kind of broaden the scope of what your clinic can offer, then let them shoot that shot, right? Let them split their time at the CrossFit gym or the dance studio and invest in them and see where it goes. And it may mean you don't make as much money as you thought you would, but some is more than none, especially in the scope of losing that therapist. And it might seem like, why are we worried so much about somebody leaving? Like, who really cares if they leave? It's some money, but we'll make it back eventually, right? And I want to kind of hammer home that the person that's going to split off with a side hustle and work at the CrossFit gym or the dance studio or at the high school team is probably not going to move across the country and do that, right? They're probably going to do that in that same town, right? They're going to be local. And what does that mean? That means competition in an area where now you cannot offer services and they are, and any sort of likelihood of you branching into that area is going to become much more difficult, if not impossible. So by not encouraging that, by not facilitating, by not investing in that therapist, you've now created competition where it didn't exist, right? So not only have you hurt your future potential profits, but you've lost money doing so by now needing to hire a new therapist, train a new therapist, deal with reduced productivity from that therapist. So you see costs at both ends with both losing somebody to quitting and them also turning their side hustle into a full hustle, right? So now you can't branch into that CrossFit gym maybe in a couple years because that therapist that left is now there, right? So now you've blocked yourself from growing into that area, and over time, if you continue to do this, you will block your growth over and over and over and over again. So understand that you can create competition where it didn't exist if you don't encourage your therapist to branch out and move into these areas and kind of secure those spots of growth for you out in the community. So that was long. I apologize. I try to keep it to 15 minutes. I try not to Jeff it up on here for 25 minutes, but I think all that was worth saying. So recognize that therapists are worth more than what they can bill. Recognize that they will trend towards different specialties, and you should encourage and facilitate that. And when in doubt, choose happiness over money. Some minute profit is better than not only losing growth in an area, but losing a really good therapist and dealing with the costs of training another new therapist up, right? So don't get bit at both ends with that third point. So I hope that helps. I hope that makes sense. Would love to discuss this all with you. So leave some comments here, shoot us an email, reach out to us on other social media, and we'll be happy to discuss this. Mitch is going to jump on here tomorrow and talk about the CrossFit Open. I'm excited. My first Open as a CrossFitter. So he's going to jump on here and talk about how to help folks as we approach the CrossFit Open tomorrow on Fitness Athlete Friday. So I'm looking forward to that. Have a great day. If you're in the north, stay warm. If you're in the south, we secretly hate you. But have a good day nonetheless. Have a good Thursday. Have a good weekend. We'll see you guys next time.